debt recovery for health professionals and clinicians can feel really hard. We're usually already exhausted and overwhelmed by the heaviness and the weight of our work, of the constant demands being made of us, the ever-changing expectations both in our communities but also of our funders, of our governments, of insurance companies, of regulators, and there's always a new ethical consideration for us to be thinking about, not sweeping under the carpet and pretending it doesn't exist. But if we don't have robust debt recovery strategies built into our private practice, regardless of whether we're a solo practitioner or we have a group practice, then we're actually going to be leaving money on the table and we're going to be working harder than we need to do the work that needs to be done. That's actually not fair to you. It's not fair to your clients, and I've got previous videos that I've talked about that, so you can go back and watch those, but it's certainly not fair to you. And I have an incredible passion for making sure that clinicians in private practice stay fit and healthy and well to be able to keep doing this work, because we have a very real role to play in providing healthcare in the landscape of our communities. But if we're not looking after ourselves, then no one's coming to rescue us. Even though that would be so nice sometimes. Be like, can you just give me $1 million and I'll just sit over here quietly and not do anything for a while? I know you've all fantasized about it. I've fantasized about it. But that's not the point of today's conversation. I just thought I'd put that out there for you. One of the uncomfortable things I needed to learn in my private practice, especially as it grew, was the need for very robust debt recovery. Now, my business was paid by a variety of sources because diversifying your income is smart business. But so it meant that all of those different ways that we received income needed to have checkpoints, and sometimes people would pay within 2 days, some people would pay within 28 days, some people wouldn't pay at all. But I do remember getting to a point where I was $60,000 in age debt, which meant various people owed me about 60 grand, and I was struggling to make wages. Sounds familiar? I know I'm not the only person to have done that. And that was a big wake-up call for me, because I just assumed people would get around to paying my invoices. I assumed that they were thinking about me as much as I was thinking about them. I assumed that they were waking up at 2 or 3 o'clock in the morning going, damn it, I didn't pay Joe's bill again. I didn't pay her invoice again. That's not happening, people. It's really not happening. But the conversations we need to have with people inside of these fairly large bureaucratic, often, organizations are conversations with people. And these are people who are often time poor, resource poor, like us, being asked to do more and more with less. So if we come at this combatively, or our first thought is to sick a lawyer on them, we are doing more harm than good. Now, I'm not suggesting that using agencies to help recover our debt is not a good idea. There is a time and place for that. But let's cover off a few things that we can build in our business first to help it become the robust asset that we need it to be. Yes, your business is an asset. Well, we'd like to think that it can become an asset, and allows us to build in processes, language, conversations, expectations, accountabilities that allow us to have effective money conversations. So I've got 5 points or 5 steps here that you can integrate that I've practiced. These have worked for me, and I've helped other clinicians in private practice implement similar types of things for their business. Nobody's 5 steps is ever going to be exactly the same in your business, because you're not the same as me. But here's a good place to start. Foundation of 5. Start before it's really overdue. So we had a particular large government payer. Always concerns me when governments are not paying, but anywho, their payment terms were 28 days. And it always amazed me how so on the 29th day, I started making noises, because the way these people dealt with this was, if there was a problem with the invoice, so say there was a code that was incorrect or a date that was incorrect, they wouldn't tell us. They'd just put that in the don't pay pile. And it became my job and soon up my practice manager's job to go and investigate and get curious. So if the payment terms are 28 days, on day 29, we were on the phone or writing emails. On the phone, talking to people gets a lot more attention and makes people do things, let me tell you. And we were actually saying, is there a problem with this invoice? And you'd be amazed at how many times there was a perceived problem with the invoice. I can't tell you how many times I've just said, not a problem, let me amend that invoice and send it back to you. And I didn't need to change anything. I just played the game. And look, the invoice got paid. You don't need to be right, I just need to be paid. I don't need to be right, I just need to be paid. So if your payment terms are immediate, then you get paid immediately. If they're 7 days, day 8, you start asking the question. If it's, you get the principle here. Don't wait 60 days if your payment terms are 14. That's a lot of time for somebody else to be holding on to money that you need to be using. Right, so start before it becomes a really big problem. So the second thing I learned to do was become curious. You hear me talk about curiosity a lot. That is a huge change because my preferred personality style is not being curious. I is a control freaky. So learning curiosity language and learning how to ask a curious question and being genuine about that. Oh, it's been a practice. It's something I still need to remind myself of often daily, but it serves me so well. So like I said in the first point, I get curious about why this invoice hasn't been paid. So is there a problem with the invoice? Sometimes the person that we've sent the invoice to, because that's who we've been told to send it to, that person is no longer with the organization. Nobody tells you this. And it's not until you've actually worked it out and you go, well, where did it get sent to? I got sent to Bill over in accounts payable. Oh, Bill doesn't work here anymore. You now need to send that to Ross. And you're like, right. So all of these things protract our ability to get paid. Now, these organizations are not sitting there thinking about us. I know it would be nice if they were, but they're not. They're thinking about what is the next thing that needs to be done? What is the next thing that needs to be done? I can assure you there is nobody sitting inside of iCare New South Wales going, my KPI is to make sure Joe Muirhead from Purple Co is happy. That ain't happening. Wish it was, but I can assure you it's not. So this matters because it's building relationship. It's not a transaction. It's like, I am here to serve you. I am here serving your people. This is a part of the agreement that we have. How do we make this work? Has there been a change in your system? Has there been a change in your process? Don't assume anybody's doing anything nefarious. Just assume you haven't been informed. It takes the pressure off everybody. But again, if you wait until day 60 and you've been waiting since day 29 for this payment, you're getting angry and resentful, and that is eating away at your soul. So we can stop that now. When I started needing to delegate this work to another person in my team, I didn't want to do that for a long period of time because, egotistically, I thought I was the only person who could do this. I also thought it was my responsibility. But I have had practice managers who were incredibly capable of doing this, but they needed a script. They needed a script as somewhere to start, not because I wanted them to use my language verbatim, because they're not me, but they needed a structure. They needed to understand why I was asking the things I was asking. And once they got comfortable with that, which meant, I had to offer them support, I had to provide them training. And sometimes people need different types of training. Some people need trial and error. Some people need case studies or, having the opportunity to observe you. That's always fun. But whatever a person needs to become comfortable in these conversations, right? Because everybody has uncomfortable money stuff going around in their head, even when they're doing it on behalf of somebody else. What was fun for me was watching one of the wonderful people that I've had in the practice manager role learn how to become autonomous in their own money management because of the script we created in my business, that they could then go and take those principles and be empowered in their own life. When I heard that sort of stuff was going on, that got me really excited because that shows me the transformation that can occur, not just because I want to get paid so that I've got enough money to pay the next insurance premium, but because of my commitment to the ripple effect that my work has in the world. So scripts, great idea, very powerful. And then you want to have some type of 3 strikes and you're out system, or 2 strikes and you're out system. Or in my case, I had a level of debt per client that I was comfortable with holding on to and giving away, essentially, before I would stop services being provided. So we would have insurance companies or regulators send us clients, and if they stopped paying us and we started to get above $500 in accrued costs, I would then start saying, no, I would not allow the clinician to do that. This was my job as the business owner to say, hey, until we can solve this problem about why this hasn't been paid, we now need to stop providing services to this client. Now, ethically, some health professions are not going to be able to do that. I get it, but there will be your version of this somewhere, and that's something that you and I can investigate together if that's what we need to do. But for me, as a rehabilitation consultant, that was something I could certainly do. It was actually in most of the service level agreements that the insurance companies wrote. So it's like, hey, if you're not going to give us funding approval and if you're not going to pay us, we can't continue to provide services. That way, my team weren't putting pressure on the client, because the client that they're serving usually has nothing to do with the money. And I've allowed that relationship, that therapeutic relationship, to be maintained. And I've taken the very didactic approach of saying, oi, if you can't pay, we don't provide services. Now, that was very uncomfortable because I originally thought that meant I would get no more work. Oh, that was the complete opposite. People were like, oh, Joe, thank you so much for letting us know. We're going to get that fixed now. We're going to get that fixed now. I actually saw organizations break their own rules to get us paid. You know, it's like, we can't pay you within 28 days. All of a sudden, the money's in my bank account 2 days later, over a weekend. Tell me how that happens, Australia. That was pretty cool to see that happen. But that's about involving people in the process. That's about helping people to stay accountable. That's about knowing your own risk profile, right? So if we had 80 clients and they were all accruing a debt of $500 each, my business would sink. So I couldn't do that. So I was always needing to be aware of how much money was owed to me. This is the part of the stuff that needs to go on your dashboard until you get to the point where you haven't got aged debt recurring in your business. So you can be letting people know, hey, I've tried to follow this up. Is there someone else I need to speak to? Escalate it. People escalate to you as the business owner all the time. Escalate this. I'm just following up with this invoice. Now, and I know many of us like to be right, so we want to, give them this mountain of information of all the times I've tried to follow this up. The person who's receiving that email really doesn't care. It's just like, hey, I've tried multiple times to address this issue with you. Is there something I'm not understanding here? Again, soften your approach, not to reduce accountability, but to actually say, I'm curious here. Has your system changed? Have we done something wrong? Oh, I remember on one of them, the way our letterhead was set up in our invoicing software was some people struggled to read our ABN, our Australian business number. We had a whole heap of invoices not being paid because they clearly thought there was no ABN on the invoice. Now I'm sitting there looking at the invoice going, it's right there on the top line where it's supposed to be. And yet they're still saying we can't see it. And it wasn't until I opened it up on a different piece of software that they were using and went, oh yeah, you really can't see that. Simple things. But people aren't going to tell me that. They're just going, no ABN, therefore don't pay. And I'm sitting over here going, oh, I need to pay some wages this week. So there are some things that we can be doing here. So boundaries, that's what that's all about, are compassionate when they're consistent and when they're predictable. Boundaries are compassionate when they're consistent and they're predictable. So there's really cool 5 things that you can be implementing in your business now. So if debt recovery is something that's uncomfortable or new, or you haven't had good role modeling on it, Jump in the comments below and let me know how else I can help you with this stuff. Now, again, not a financial advisor, not a CFO. I'm just somebody who's had to learn from the School of Hard Knocks, and also because my mum was a bookkeeper and that was pretty cool for me. And also, I hate being in debt. I just hate it. I don't subscribe to the good debt, bad debt thing. Debt makes me uncomfortable. And there's a whole backstory to that, which I can tell you a whole nother day. So subscribe to these videos. Let me know your questions and your comments in the comment section below. Go be awesome. And I'm going to finish my coffee.